tuned in to The Andrew Lawton Show.
Obviously, the death of free speech is incredibly important, but it is an issue that pales in comparison to some of the very real and very mounting deaths that are taking place across the country because of MAiD, the euphemistic name for doctor-assisted suicide, which is quickly making Canada a very unlikely, and I would say unpleasant, capital around the world, even more than many places in Europe. And when you compare the Canadian story to that of, say, California, it is particularly egregious that this has been something that Canadians have embraced, except maybe not. The Canadian government seems to be putting forward an approach on this that is incredibly liberal and incredibly open, but Canadians are, even generally socially progressive Canadians, finding themselves a little bit uncomfortable with the status quo. Certainly as we move to further this liberalization by expanding assisted dying to those who have solely mental illness, as we have stories of people whose issues are not even medical in nature, but to do with housing or inequality or poverty. This was put under the microscope in a fantastic, but I will also say chilling piece in the National Review by Alexander Raikin, How Death Care Pushed Out Healthcare. Alexander joins me on the line now. It's good to talk to you. Thanks so much for coming on today.
It's a pleasure to be on.
So, I mean, you've written about this in the past, and this is one of these issues. I mean, the Freedom Convoy was one. These internet regulations we were talking about are one. But this issue is one that I'm getting people that I know from around the world coming to me and saying, what's going on in your country? Is that similar to reaction you've seen from National Review readers?
Oh, 100%. I mean, the earlier speakers said that if you violate the criminal code, you'll face repercussions. There's an exemption to it. If you're a physician in Canada who provides medical assistance in dying, you don't face any repercussions for talking or even violating the criminal code. So one of the cases that I talk about is a patient it's a group of physicians flippantly discussing sedating a patient into MAiD. This would be unthinkable just a couple years ago. And yet, no repercussions, no investigations, no apologies. And this is part of the course for how MAiD functions in Canada.
One of the things, and you touched on this, and I'm glad you did, because it's often missing from the story, is that there is the letter of the law and the letter of the regulations, and then there's the actual practice on the ground. And it's long been established, even when MAiD restrictions were fairly stringent in nature, that there were situations where these rules were being bended, where capacity rules, eligibility rules were. And if you keep that pattern in place and you expand the regulations, it stands to reason that it will become even more permissive as time goes on.
Exactly. Every day in 2021, and I'm saying 2021 because we're still waiting on the 2022 data, but every day in 2021, more than 29 Canadians died by the hands of their physicians or nurses. That's double the official suicide rate. If we were talking about any other group of people, if we were talking about any other people besides people with disabilities who were being impacted by this would be a national tragedy. And yet, I don't really see this being reported in mainstream media in Canada.
No, and I'm kind of curious about this, and I'm not second guessing your approach to publish it in an American outlet, but I'm wondering why you think Canadian media has not been as interested to do this deep dive.
That's a good question. I mean, we definitely know that there is an element of bias in all of this. CBC, they had a pretty good investigative report on the Fifth Estate that looked into all the ways that MAiD was falling short in Canada. And yet, unlike other Fifth Estate investigations, it was never pushed on CBC's website. It was only on cable, which is pretty jarring. Now, like they have other reports that are pushed to their online newspaper. And yet with MAiD, for some reason, editors decided not to do that. And you can see this throughout the whole gamut of conversations around MAiD.
One of the things that I found interesting was situating Canada in the global context, because I used to, when this issue came up, look to the Netherlands and Switzerland, I think, and be like, oh, although like we're never gonna. I don't know if I would have ever said we're never going to be like that, but I certainly would have said we're far off from that. Whereas, how would you actually, having done the research and the legwork, rank Canada against some of those really permissive approaches to this in Europe?
Oh, I mean, we already have the largest and most permissive assisted suicide program in the world. In the Netherlands and Belgium, they have additional safeguards where if a patient wants to apply for euthanasia or assisted suicide, they have to at least try some acceptable level of medical treatment first, right? This is a very commonsensical safeguard. In the Netherlands, physicians would not push MAiD onto patients. And yet we have stories of exactly that. In the Netherlands, there are review processes. There are no such review processes in Canada. So I mean, we're already far ahead. I mean, just look at the numbers, right? Over a span of 7 years, we're on track to have a 13-fold increase in the number of euthanasia and the number of deaths from euthanasia. We have never seen that anywhere in the world.
Amanda actually, Sean, if you could get that picture that I sent you from Amanda Actman in the queue, I want to show that in a couple of moments here, because I'll ask you about where you think this goes from here, because I do feel like the government, when it loosened the restrictions and put that change in place on the mental illness aspect, that was a turning point, and that was what moved this from a lot of like into a territory where a lot of people were very uncomfortable with this, and even people that you wouldn't call social conservatives or pro-life activists. Do you see that continuing, or do you think, like anything else, people will talk about it for a couple of moments and then kind of forget about it and move on?
I don't think people are going to be able to forget about this or move on. I mean, just look at the disability community. You have over 140 disability organizations nationwide saying that the latest expansion to MAiD was a direct threat to their lives. Over 140. You have the United Nations, several human rights experts at the United Nations condemning Canada for expanding MAiD to those who are not terminally ill. And even those who are terminally ill are dying at a later stage than in other jurisdictions. So it's pretty fascinating to think about this, right? We had over 140 disability organizations. Pretty much every single major disability organization in Canada made a firm statement against MAiD. You had another letter that came out earlier this year. And yet the reaction from Canadian media has been pretty abysmal. And the reaction from the government has been even less. So I don't think that people are going to be able to forget this or move on. When we're talking about the massive normalization that certain lives are not worth living.
Amanda Actman, who's a pro-life advocate and speaker, I forget where she's based now. She's moved around. She shared this image that I wanted to show you and the audience. This is an 88-year-old woman from Calgary named Christine Nagel, who, if you can make that out, never had a tattoo in her life, but at 88 got tattooed on her arm, "Don't euthanize me." And you can say it's a bit cheeky and feisty. Sorry, she's 81, not 88. My apologies. You could say it's a bit cheeky and feisty, but at a certain point, there must be some people that genuinely live with a sense of fear that their life will be ended when they're no longer in a position to say, I don't want this.
Right. I mean, the impact is not just on physicians who are being censored, and we can discuss that, or hospitals that are effectively being defunded because they're choosing healthcare over death care. The largest impact is on patients. Patients like Rachel, who I spoke to, and I talk about in my piece. She's someone with disabilities. She has chronic disabilities. She has a chronic pain condition. She has depression. And yet, when she tried to get help for her depression by calling suicide hotlines, she was instead being advised to look up Dying with Dignity Canada. Like, think about what that means. You call a suicide prevention hotline, and instead, you're getting recommended ways for you to die from assisted suicide. And she said, and I'll read this quote, "I've been afraid, over those last couple of years to go to just my local hospital because I was afraid that if any doctor either brought up MAiD themselves or met my kind of ambivalent desire for MAiD, all I needed was a push and I'll be dead right now." What she ended up needing to do was to purchase a bus ticket for an hour, like for an hour and a half away. She had to go all the way to Toronto to MAiD, which is a mental health hospital, the largest mental health hospital in Canada, that does not allow MAiD on site, in order for her to attempt to get healthcare. And we know how broken the healthcare system is. So it doesn't seem to be kind of a coincidence that you have the largest expansion of euthanasia ever seen in the world in a voluntary euthanasia system happening at the same time that Canada's healthcare system is disintegrating.
Well, it's a very important story, and you've touched on Rachel's story and many others in the feature you wrote for the National Review, which is in this month's issue, and also online, How Death Care Pushed Out Healthcare. Alexander Raikin, very good work on this, and thank you for coming on today.
Thank you for having me on.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.